Hello, my name is Dr. Julian De Silva. I'm a board certified facial, cosmetic and plastic surgeon, and today we're looking at deep plane facelift. What is a deep plane facelift? Is it better than other types of facelift or neck lift surgery? Well, essentially it means lifting the anatomy beneath the SMAS. And the SMAS is a cushion of soft tissue that lies in the face, that lies just beneath the skin. And it tends to create these creases, the nasolabial, the marionette creases next to the nose, next to the mouth, which have come about with age and gravity. Well, it means that the ligaments all the way up to these pink lines are released, and this area is lifted upwards, which is shown by the yellow arrow. And this is essentially lifting the soft tissues that have come down with gravity. Now, this procedure takes twice as long as a conventional SMAS facelift, usually 3.5 to 4 hours. And it's an advanced technique because it requires a good understanding of the delicate and intricate anatomy in this area, because there are important structures such as facial nerves that need to be treated with caution. What is a traditional SMAS facelift is the area that is lifted is towards the ear, as shown by this blue arrow, which tends to be a horizontal vector. Now, this does make a difference. It does improve the jawline, it does improve this area. However, it's not quite the same as lifting the area that has come down with gravity, but it is faster to complete. Some surgeons could do 2 or even 3 facelifts in a day because of that. Maybe it's not quite as natural because it does less to these folds that tend to acquire with aging. And of course, it does require more changes in the neck. Well, it's this area that comes down with gravity. Now, as the cheek comes down with gravity, often you can see a depression or a shadow in that area, and sometimes people will have fillers put into those areas in order to rejuvenate things by adding volume. But what also happens because of gravity is this fold develops called a nasolabial fold, because it lies between the nose and the mouth, and often you notice increased lines or shadowing in the marionette area, particularly if you have a smaller chin. Now, because all this area is coming down, often you start to see loose skin in the neck, and often underlying this is a band called the platysma, which is really the muscle in this area that has become loose. So what do we do with deep plane facelift surgery? Well, the principle is a vertical vector of lift. Now, because we're lifting upwards, it tends to give a more natural rejuvenation, and whereas your face becomes squarer with time, lifting upwards restores the very V-shaped, natural, youthful appearance. Now, the other thing that we need to consider is this kind of grey area of anatomy is ligaments. And so there are ligaments that kind of tie things like a bit like glue in place. And so in order to lift in the blue arrow direction, we need to actually release those ligaments in order to lift the face upwards. So deep plane facelift and neck lift procedures, well, it makes up less than 5% of facelift surgery, and it corrects against gravity. It reduces the nasolabial lines, it reduces the marionette lines, and of course this does tend to take longer than a conventional SMAS facelift, and it does require avoiding certain anatomy. Deep plane facelift surgery is lifting upwards in the green arrow direction. However, more conventional SMAS facelift surgery is lifting towards the ear, which is a more horizontal vector. Now, the horizontal vector tends to take about 2 hours and is lifting in the fixed SMAS. However, deep plane facelift surgery, because it extends further into the central part of the face, it takes twice as long, more like 3.5 to 4 hours, and it requires good understanding of the anatomy. So this is one of my patients, and we can see it's a younger person where she's got some deeper folds in the central part of the face, there's some early jowls, and there's a few changes in the neck. Now, by doing a vertical deep plane facelift, this area is all lifted up, it shows a natural shape to a contour, and minimal changes were done in the neck area, but because everything's been lifted, it has restored a more youthful neck and jawline appearance. This is a gentleman with a lot of loose skin and platysma muscle in the neck area. You can't see the jawline, you can't see the contour or the bone structure. However, the same principle, lifting everything upwards, well, we can see he has actually got a good, well-defined jawline. There is good bone structure there. but it's just a question of lifting everything upwards. And in order to do that, I needed to release these underlying ligaments in this central area, and then everything lifted upwards. We can hide the scars around the natural curves of the ear and behind the ear, which even in a man with short hair can be done very effectively to hide these scars. This is another one of my patients who'd had previous face and neck lift surgery and just had noticed the more tired appearance around the mouth, more tired changes in the neck. And so we can see with certain angles, the patient looking downwards, there's a lot of kind of like gravity and loose skin and loose soft tissue in this area, and also the eyelid area is also kind of drooped with kind of excess loose skin. I analyze the face using a golden ratio, which is an objective measure that we can use to analyze a human face to look for natural beauty. And lifting everything upwards, well, we can restore the jawline, we can reduce the jowls, we can reduce the changes in the neck, but it doesn't mean lifting the deep plane of the facelift in order to restore this central area. Another patient of mine, well, we can see when this lady was younger, she had this very beautiful V-shaped jawline, and with time, the effects of gravity have resulted in jowls, marionette lines, nasolabial lines, and a real change in this kind of central area of the face. Now, as we can see, as this area comes down, it adds on to increased volume in the neck, showing loose skin, platysma bands, and so it's really this area that comes down with gravity. So this was a conventional SMAS facelift that would lift towards the ear. But you can see, because of gravity, if we lift in a horizontal vector, it's just not going to improve this neck area. We really need to lift upwards in order to restore and lift against gravity. So that's exactly what I did. I did a vertical deep plane facelift, I released all the ligaments, lifted everything upwards, restoring things where they used to be. And again, now we can see the V-shaped jawline of youth. We've softened all the shadows like around her mouth, and by lifting the eyelid area at the same time, it's given her very natural rejuvenation, and she looks fresher and younger as a result, and she had a lot more confidence and was very happy with this kind of procedure. Talking about celebrities who've had face and neck lifts, well, some people have expressed a lot of regret. Sharon Osbourne, Jane Fonda, Joan Rivers, well, they have really expressed a lot of regret having procedures. However, when things are done naturally, such as a vertical deep plane facelift, you restore the natural appearance of your jawline, and with good surgery, it can be very difficult to tell whether people have had surgery because the surgery looks natural. And there are certain people who have speculated, Nicole Kidman, Jennifer Aniston, Tom Cruise. No one has confirmed whether they've had this facelift surgery or neck lift surgery as of yet. However, they certainly look youthful, they certainly have a youthful V-shaped jawline, and with good surgery, the appearance looks natural but doesn't hide every single line, and the scars can be very discreet around the curves of the ear that make them very difficult to see. So in summary, a deep plane facelift neck lift, it reverses against gravity, it lifts in a natural direction, and it is the only way to truly improve these kind of deeper lines in the central part of the face. It certainly does take longer to complete, and there are delicate parts of the anatomy and nerves in this area, but currently it makes up less than 5% of facelift procedures that are done. So answering our question, is it better than other facelift and neck lift surgery? Well, like most things, there are some advantages and some disadvantages. The traditional SMAS facelift, well, it is faster, but it does require more surgery in the neck to tighten the neck area, and the face is not completely corrected in the central area. A deep plane facelift, well, it takes maybe twice as long to correct, but it does make a much more significant difference to the nasolabial and marionette folds, and as a consequence of that, it gives a more V-shaped and natural appearance. I do hope this information has been helpful for you. Thank you so much for watching. And if you have any other thoughts or questions, please do not hesitate to contact me either through my website or through social media. Thank you.